Now, it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. South Korea's new COVID-19 infections were under 7,000 for the second straight day Sunday, but critical cases hit yet another all-time high, almost 900 on Sunday. Now, concerns are rising about this situation putting a very serious strain on South Korea's healthcare system. There's also the continued spread, as we just heard from our Shinya in there, of this new Omicron variant.
And from today, a one-week grace period is no more. The vaccine pass system is applied to restaurants, cafes, private education academies and internet cafes. Businesses found to be in breach of these rules will also face big fines. And for more, we connect to Dr. Alice Tan, internist at MizMedi Women's Hospital in Seoul. Now, hello, Dr. Tan. It's lovely to see you again. And well, Doctor, over 81% of people in South Korea have been fully vaccinated, with around 12.5% having had the booster. And we were told that vaccines would reduce severe illnesses, but we've had a record number of seriously ill people. The government says that the answer is more boosters given at shorter intervals. But considering what we're seeing at the moment, do you have confidence that these boosters are going to be any helpful?
Well, good morning. Thank you for having me on. Yes, since July of this year, that's 5 months after starting our national vaccination campaign, we have been seeing a significant increase in the number of breakthrough infections. However, ever since we started our booster campaign, that number of breakthrough infections has gone down significantly. From previously, it was 180,000 per 100,000 vaccinations were breakthrough cases. And since delivering third shot boosters, that number has gone down to 17 per 100,000 cases. We know from laboratory data that delivering a booster will increase antibody levels, will increase T-cell responses. So yes, I am confident that delivering boosters will help us fight the pandemic and will eventually save lives. We should note that since delivering boosters, third shot boosters, there's only been one severe case of a breakthrough infection, and there have been no fatalities reported after a breakthrough infection case subsequent to a booster dose. Third shot booster.
Okay, and this next question is a topic of a lot of controversy here in South Korea and in many other countries around the world. It's about the vaccine pass system. Seoul mentioned around 81% of people in South Korea have been fully vaccinated, but that means still a fifth of people here have not had a vaccine or aren't fully vaccinated, and as a result of these mandates where you can't go to a restaurant, you can't go to a cafe, you can't go to the cinema if they're not fully vaccinated, it kind of almost lends itself to unvaccinated people being kind of like second-class citizens. Now, where do you stand on an ethical level on this? And are we at a point now where this is going just a little bit too far?
Well, so, 10 million people have not received COVID-19 vaccinations in our country. COVID-19 still causes severe disease in 2% of everyone infected. So if we do the math, that's 200,000 cases of severe disease that we can anticipate from this population of unvaccinated people. I do not want to see 200,000 more ICU cases due to COVID-19. What this means for our country is the pandemic will be prolonged. There will continue to be increased deaths due to COVID-19, and our country will continue to suffer the overwhelming collateral hardships of this pandemic because of this large pool of unvaccinated people. And so basically our country will be, I hate to say it, but held hostage because of this pool of people who refuse to get vaccinated. So what do we need to do? We need to make more effort to try to convince people who are hesitant about getting vaccinations. We need to make sure that the process is facilitated for them. We need to make sure that they get all the information that they need so they can get vaccinated with confidence. And I think that's the type of effort that we need to make, because the numbers, they tell us what direction we're heading in if we don't do a better job convincing people on the fence to go ahead and get their vaccinations. Already 6.3 million people have gotten their third shot. Of course, I'm grateful to every single one of them for doing their duty. And really, vaccination is what's going to help us get through the pandemic. And we have to do this before the Omicron variant becomes more widespread. And of course, we still need to wait several months before an oral antiviral pill will be available, which will help, but that's still in the future.
Well, many parents are also opposed to giving their children vaccine, but the government is, of course, now pushing to vaccinate more and more teenagers. And while the health ministry says that 51,000 teenagers have had the virus, but 0 have died. So we keep hearing that it's to protect other segments of the population, the elderly. But then some parents may ask why they should put strangers over their own kids. I mean, what do you make of this, Dr. Tan?
Well, 3 children between the ages of 0 and 10 have died due to COVID-19. There's a child between the age of 10 and 19 who is in the ICU right now due to COVID-19. So it's not just about protecting other people. It's about protecting your own child against severe acute COVID-19 disease. It's about preventing potential long-term effects of long COVID, which could potentially affect the brain, affect the heart. And we don't know when long-haul COVID ends. And I would hate for a parent of a child to have the child suffer from long-term consequences of a potentially preventable disease just because they chose not to get vaccinated. And it's also about, protecting entire communities and getting our society back on track to leading, pre-COVID life. And so there are many, many compelling reasons for why we need to convince adolescents and children later when the vaccine is approved in younger age groups to get vaccinated. It's not just about other people, it's about protecting children as well and keeping schools open.
Yeah, well, some parents might counter that by saying we don't know the long-term effects of these vaccines because they've only been out a couple of years and haven't been tested on animals and things like that. But finally, I just want to touch upon Omicron. It's been the dominant variant in South Africa now for quite a while. But according to the latest data, I know it can change, but hospitalizations there have dropped to their lowest level in quite a while. And some experts are saying that potentially, if Omicron becomes the dominant strain, this could potentially be some kind of blessing in disguise.
I disagree with that. If you look at the statistics from the South African National Institute of Communicable Diseases, the average number of daily hospitalizations due to COVID-19 has actually gone up tenfold from November 8th to this most recent week. And so we would, I'm just imagining what would happen in Korea if our hospitalizations due to COVID-19 went up tenfold. I mean, it would be a horrific situation. They went up from an average of 38 COVID-19 hospitalizations a day to 380 admissions on average per day since the spread of the Omicron variant. And so it really is a serious situation in South Africa. It is true that their case fatality ratio has not gone up proportionately, but the number of cases due to COVID-19 has also soared. On December 9th, they logged more than 22,000 cases of COVID-19. But we should remember on November 8th, right before Omicron took off, they were having 116 cases of COVID-19 per day. that steep rise in daily new cases has been quite remarkable, and we do not want to see the same type of pattern happen in our country. We do need to wait in terms of the virulence, finding out how severe the illnesses will be. But the increase in hospitalizations, I think that is enough to make us worried and to make sure we stay vigilant.
Dr. Alice Tan, as always, we're very grateful for your insights. Thank you for joining us.
Thank you.